Also in the news, the hot weather. Hot or cold, it doesn't matter to some folks. You may sweat or perspire like a faucet. Underarms or even palms of your hand or the soles of your feet. Well, dermatologists call this excessive sweating hyperhidrosis. Our live line guest can give you an idea of how it's treated. Joining us now, dermatologist Dr. Quarles. You can give him a call with your skincare questions, 673-5420. Every now and then we'll see someone who is just pouring water. It's called hyperhidrosis?
Yes, in a cool room where it's 60 or 70 degrees and you shouldn't be perspiring. Some people are dripping perspiration from their palms, in their underarm area, or on their soles. And it's very embarrassing for them. It's a quality of life issue.
Is it something that's caused or something that you just have?
Well, there can be some underlying causes for it. There can be some metabolic causes like thyroid disease, or sometimes people with diabetes may even have some excessive sweating. But hyperhidrosis really has more to do with the nerve endings in the skin that are triggering these sweat glands all the time, and they just don't stop. And that's where it's very, very embarrassing, and it's tough on their clothing and quality of life.
We're going to get to the treatment in just a second, but let's take a call. Kim in Virginia Beach, you're on with Dr. Quarles. Hi.
Hi, Dr. Quarles. My daughter is a nurse at Norfolk General, and she's been suffering for, 5 or 6 years. She cannot get gloves on. What can she do? She's so sweaty.
Yeah, she may have hyperhidrosis. There's moderate and severe hyperhidrosis, mild, moderate, and severe. For those moderate type folks, we can use some topical medicine we prescribe called Drysol. It's a very strong antiperspirant, stronger than what you buy over the counter, and you apply that at night. And then you can also have some electronic battery-operated device that's used in a pan of water that affects the sweat glands. And then there's also...
What, do you stand in the pan of water?
No, you put your hands in the palm or in the water.
Even if you're sweating under your arms or on your feet?
Well, that won't treat your axilla.
Okay.
She's talking about her palms.
Okay.
And it's not end-all. And then there's also Botox, botulinum. You know, people use Botox for wrinkles, but you use Botox in the underarm area, and some off-label uses are Botox injected into the palm. But it's tough to apply, and it can be a painful experience. But then there's sympathectomy, where you cut the nerve that causes the sweating.
Let's take another call. William in Norfolk, thanks for waiting. Hi.
Hey, I have found that as I've gotten older, I sweat heavily from my head, and most recently on one side of my head. What does that mean when it just comes out of one side more so than the other?
Now, that is interesting, and a few patients will just have more on the forehead or one portion. That's probably neurogenic. And there's really not much you can do about perspiration on the forehead or on the top of the head. Most of the hyperhidrosis that we address has to deal with the hyperhidrosis involving the axillary area, underarms, palms, and soles.
Best to get checked out. Maybe the cream would work, but you'll try different.
Yeah, well, maybe the Drysol, if it's not too irritating on that portion of his forehead, might be helpful also.
Well, Dr. Quarles, thank you very much.
You're welcome.
Should you have questions about skincare in general, you can reach them in Virginia Beach at 490-6635 or in Hampton, 827-30.